What kind of delays and frustrations do you see patients facing most often in their journey?
I think everyone in the UK can see waiting lists is a main problem and is the biggest sign to everyone that there are cracks in the system. Talking about the patient journey, I think one thing to recognize is the NHS design the way it is. Years and years ago, now it's got massive, fantastic actually legacy and history, but it's designed in that way in order to, in some ways, keep track of the system, the costing of the system, and therefore the GP very rightly is in a very good position local to the individual and initiate a lot of the pathways and is a central point. But in reality, that doesn't work that well. So it actually puts a lot more pressure on the GP, and therefore administration around primary care is enormous. And at the same time, to a patient journey, you could be in a hospital, for example, they think you've got an imminent issue and you've got something else that could be resolved there and then. Let's say to see another specialist. The pathway is, we'll let your GP know. Your GP will then see you. Your GP, if convinced, will then refer you back to the same hospital to then see another specialist, for example, to maintain the sort of the funding streams. But actually to a patient, that means that's another few months. And that may or may not be a problem underneath what their current complaint, but is not clear until the next doctor see them.